It's the 2020 Covid-19 pandemic, and we demand and we call on the labour movement to demand. 1. Requisition, taken to public ownership and under democratic control. Private hospitals. The pharmaceutical and medical supplies industries, enabling coordinated and increased production of tests, PPE, ventilators, etc., and coordinated research into treatments and vaccines. Social care provision. High finance to prevent the pandemic being compounded by a credit implosion causing economic slump. Transport, logistics, supermarkets, and other sectors where coordinated mobilisation is necessary. 2. Workers' control. The safest, most effective way to organise production is for workers ourselves, taking expert advice, to identify and run essential services. Workers can determine the best working methods and the best time, pace and methods to ease restrictions. 3. The labour movement is an essential service. The labour movement has a duty to make itself an essential service. 2. Impose workers' control on the emergency response to stop its obstruction by bureaucratic inertia and profit priorities. Defend workers' rights, including those still at work in essential services, those self-isolating on public health advice or at home to look after children, and those already laid off. Stand up for the worst off, who generally suffer the worst in epidemics: low-paid and insecure workers, homeless people, migrants, prisoners, disabled and elderly people, ethnic minorities. 4. Defend workers' rights. All whose work is not essential to be at home, working if possible, on special leave otherwise, on full pay. Full pay for every worker, including 0 hours, agency and subcontractor staff, who takes time off following public health advice or to care for dependents. Work or full pay, immediately accessible fallback pay for all. Cancel rent, mortgage and utility payments. 5. Take care of the worst off. Release people held in detention centres and offer accommodation if needed. The same for prisoners, excluding only those who pose a threat to human life and safety. Scrap no recourse to public funds and other rules and charges restricting public services for migrants. Suspend enforcement of restrictions on migrants, enable so-called illegal immigrants to get help and defend their rights without risk of deportation. House the homeless, rehouse the overcrowded, stop evictions. Make hotels and similar accommodation available to domestic violence victims. Increase welfare benefits. Stop the coercion of vulnerable people to agree to do not resuscitate orders. 6. Defend civil liberties. There is a public health case for restricting movement and assemblies in the pandemic, but the Coronavirus Act goes beyond this. In particular, we demand the repeal of the relevant sections and the restoration of the rights of people in mental distress not to be incarcerated on the say-so of one doctor alone. Bereaved people to a proper investigation of the death of their loved ones. Education of children with special needs. People to be assessed for social care needs and have those needs met. We want the right to strike, picket and demonstrate restored with due care for social distancing. And we champion workers using their legal right to withdraw from any work they believe poses a serious and imminent danger to health and safety. 7. International solidarity. The labour movement has a duty to think internationally. We demand massive aid to poorer countries, and that people in refugee camps around the world are resettled in decent conditions.